Good afternoon. Sharon Meyer speaking. I'm the Integrative Nutritionist at the Institute for Health and Healing. So welcome. Lovely to see that a few of you have checked in today. And let's start talking about last week's conversation. Last week, I spoke about goals for 2021, how to make them, how to execute them. And so I just want to refresh your memory, and for those that didn't check in, this is what we were talking about. 2021, I suggested you make a list of all the things you would like. And the idea around this was to use your imagination. No holds, no limits, no restraints. Absolutely think about what you want to do. You don't think about anything else, but this is what I would like in my life without any of the constraints that we put on our thought process. So, and when you were doing this, it was really looking at your physical well-being. Included with that would be your social well-being, your mental and your emotional well-being, your career and financial well-being. All of those would be important. And one of the ways that we looked at this was to do sort of like a massive big project, like shape the pieces of paper and brainstorm it. Just brainstorm all the things that you want to do with this. And then you plan it out. So if you were brainstorming, these are all the things I want to do, and it doesn't matter how impossible it seems, you just write all of this down and you plan out your year. So I'm just recapping a little on this because it's such an important part, and this is our second week of January, and already our first week of January has been somewhat chaotic, to say the least. High amounts of COVID, and then of course the disruption that we had last Wednesday, which sends everybody doing all crazy things like craving carbohydrates again, and it impacts how we function, and also sometimes can be a detriment to our planning of the year. So hence the reason to recap on that. So the idea around all of this is you set your long-term goals. First you set your long-term goals. Firstly, actually, is what do I want? You sit with a sheet of paper and you brainstorm. You can use as many pieces of paper as you want to. And then you need to execute. So execute is you set your goals and you be really realistic about these. And lots of the times we're a little over-ambitious about those goals. And then when you do the execution of this, it is the long-term goals. So here are my goals for the whole year. Then what are my goals for 6 months? And then what are my goals for 3 months? And then what's my goal for 1 month? Then 1 week? Then 1 day? That's how you set your goals. And as I say, be very realistic about those, because sometimes we overdo it with that. So cleansing and detoxification would be a huge recommendation of mine to include in your goals. And I always think that we should cleanse or do a detox twice in a year, certainly in the spring. So you may be thinking about when you should start doing this, and this is just food for thought and might be something you include in your goals. And then the next time you do that is in autumn. So when we use the word detox, it has two common meanings. The first one is to withdraw from the use of drugs or alcohol, to which one has developed an addiction. And we could say the same thing about foods, right? We could say the same thing about carbohydrates. But the second detoxification definition is describing the body's physiological process of rendering chemicals, compounds, hormones, and toxicants less harmful. And the second definition is the process referred to as more metabolic detoxification. So our organs of detoxification work very efficiently as a whole, and they their function is to reduce the body burden or toxic load of chemicals. And these organs that are involved in this include the liver, the kidneys, the large intestines, the lymphatic system, and the sweat glands. Now, what we do know is that 1 out of 3 Americans have some form of chronic disease, and most of the rest experience symptoms of one developing. So when we start to look at these changes in our metabolic pathways, and this happens often, we want to be able to support those functions. So when we're looking at detoxification, there are well-defined metabolic pathways in the body that are so responsible for converting toxins into chemical compounds. And then it makes it easy for the body to eliminate them. And normally the way we eliminate these toxins or chemicals is through the urine or the stool. And the way this has been studied has been pretty much emphatically around metabolizing and clearance of drugs through the body and how well that works. And a lot of the pharmaceutical companies, when they're looking at the clearance of drugs, look at those detoxification pathways. Now, we know that the detoxification pathways are an ongoing process that happens all the time in the body. Otherwise, we wouldn't be able to survive. But where do these toxins come from? A lot of them come from pollutants and plasticizers, heavy materials, heavy metals, toxics from bacteria, those that are within us. And then we look at chemicals too. So a lot of exposure comes from agriculture production, so pesticides, herbicides, and fertilizers. But the most commonly occurrence are those toxins that occur in the house, in our households. And that's, think about this in the winter when you have all the windows and doors closed, then we don't get rid of those toxins. And that could be a really good place to start. Firstly, opening up the windows, clearing things, having air move through your house. The air conditioners and the heating, all of that impacts the function of toxins in your house too. You want to clear them out too. And then start looking at some of the chemicals that we use with our cleaning materials. Even if we make those small changes, that's huge and takes that layer or that heavy load off these systems in the body. So we start off with there, that's a really good idea. And even from a COVID point of view, there's lots of data about COVID not flourishing in areas where there is a lot of air, but certainly in stagnant air and also in warm places. So opening up those windows, folks, would be a really good idea. As chilly as it may be, do it for an hour or so. You're clearing things out of the environment. So when we look at these toxins, we talk about a person's toxic body burden. And when that's involved, it's about your ability to clear these toxins. And it can be genetic. It can be the accumulation of toxins over the years. And it can just be those systems that you have for the detoxification process are a little overwhelmed and overloaded. So the first place you would start off with is looking at what am I eating, what am I drinking? And certainly if there's been a time of celebration and there's been lots of alcohol and maybe some champagne and Prosecco and whatever you're drinking, wine, now would be the time to stop that. Or a better way is find a time when you want to start a cleanse protocol. As I say, I think it's a better time to start it in the spring, but you can be thinking about doing this too, maybe the end of February. But include this in your goals because this is about how you support your body. So the way you would start this off would be no alcohol, no sugar, you reduce your carbohydrates, and certainly cutting out things like gluten and dairy. That would be a very, very good start. So your first week would be vegetables, some protein, nuts and seeds, fats and oils, fruit. You do that for 10 days. Your second week would be doing just vegetables. So it would be vegetables, some fruit, coconut, fat, or oil, olive oil, avocado, olives, those kinds of fats. No grains, no legumes, no dairy, no sugar, no protein, no alcohol, no nuts and seeds. The second week is really the big detoxification week. This is the week where it's lots of soups made from vegetables. You can have fruit as a sweetener, and you can use lots of olive oil, and you can use any coconut product. So what we do in the second week is really take away all the foods that might be inflammatory. And we know that nuts can be, for many people, a source of high inflammation. You know, they have a high amount of lectins in them, and you could be reactive to those. So the second week is the major detoxification week. And then your third week, you start to bring in some of those foods again. So your third week, you bring in some protein. See how you feel. You can up the olive oil. You can add specific foods that support you through this process. Normally when I'm doing this, I will also use specific protein powders that support detoxification process. And we can always talk about that at some stage later. I am going to be doing a cleanse protocol, and that will be sometime at the end of February. So you're most welcome to join us for that. I'm also going to start the next weight loss program, which will again be, I think it's around about the 24th or the 25th of February. I forget the dates. But we'll certainly be posting that in the wellness program, and you'll be able to see when we do that. And it's going to be the weight loss as I've done before, but with various speakers talking about different ways of losing the weight. But the protocol is going to be ketogenic diet and weight loss. And ketogenic diet it's really a high fat diet. And for those that are vegans or vegetarians, there's that option as well. So we will be doing for anybody. So it will be protein, vegan, vegetarian, depending on what your desires are or what your needs are. And then we will also have a time of doing a cleanse through these protocols. So that's what's happening in February. So if you'd like to join us for that, that would be great. So hold on to your seats as we begin our program for February. Any questions? Okay. So the idea of this is to include the cleanse in your goal setting. Okay, my dears, take good care of yourself.